stay healthy and eat healthy because the eyes are part of the body. Protect your eyes from the UV rays. It will help your eyes in the long run.
Protect yourself from the sun as much as possible. Don't go out 10 a.m. to 2 p.m. Drink lots of water, even more than 8 glasses a day.
But in general, if a problem is lasting more than 3 to 5 days, you go see your doctor.
A human being has 5 senses: the sense of sight, sound, smell, taste, and touch. Our senses allow us to experience and better understand the world around us. While it's normal to encounter some decline in its health as we age, there are things that we can do to reduce the risk of problems as well as disease. I'm Dr. Freddy Gomez. Join me as we learn ways to care for our 5 senses. Welcome to MedTalk Health Talk. Eye problems and problems in vision are common here in the Philippines. Let's take a look at how we can best take care of our eyes and our sense of sight. We are joined by Dr. Reginald Robert Tan, who is an ophthalmologist and corneal specialist from the St. Luke's Medical Center. Now, we are here in your clinic in St. Luke's to have a basic eye exam para we can show our viewers what someone needs to take in order to have healthy vision, basic eye health, kumbaga. Okay, let's start off first with the basic eye exams. Our viewers will see your equipment here, which is complete. Now, these equipment might look similar because these are some of the equipment na probably nakikita sa mga eyeglass shops sa mall. So, what are we trying to achieve here with these equipment? What basic anatomy muna tayo with our eye? What are these equipment trying to look at in a person's eye?
So basically, we want to know what the problem is. Kasi if we look at the eyeball, there's always the front part, the middle, and the back. So we want to isolate which one is causing the problem and which one is causing the blurring of vision patient.
So when it comes to near or distant vision, why should this be a concern for our viewers? Kasi some people might have a problem with their vision pero tinitiis na lang, di ba? They can compensate for it. Why should this be addressed?
My philosophy there is as long as the patient doesn't really complain, it's okay. So even if the patient has a high prescription, but the patient is able to perform their regular duties, perform regular activities, whatever they like without any glasses, then it's okay. But as long as they have difficulty doing those things, then they should seek ophthalmological help in order to have their eyes checked.
Dr. Reg, let's start off. Let's show our viewers what entails a basic eye exam. So where do we start?
Let's check your vision first,
Okay.
one eye at a time. So we have to isolate because the right eye is different from the left eye. So kindly hold this and then cover your left eye.
Okay.
I want you to look at the chart here and read to me the letters that you see from left to right.
Okay, from left to right, that's a G, V, E, an H, and a P.
Okay, this one.
Okay, that one is, I am definitely using more effort now, but that is an F, a P, an N, a V, and an E.
Great. That's
Great.
perfect.
Okay.
Okay, so let's try the other eye
Okay.
this time. I'm going to change the letters here, but same difficulty.
So with this one, I think it's a Z, H, E, a D, and an N. Yes, that alone I can can
With a lot
tell
of effort.
that my left eye is definitely different from my right in terms of what it can see clearly.
We use numbers in order to quantify the accuracy of your vision or the acuity of your vision.
Okay.
So far you're like 20/20 both eyes. So
Okay, that's good to hear.
perfect.
What's next in the step of a basic eye exam?
If the patient has a little bit of difficulty reading the small ones and even the big ones, our first hunch will be the patient has the most common cause of blindness or blurring of vision is a prescription or just a grade. I'm going to use the first machine here. Just going to move this towards you. Kindly place your chin here.
Okay.
Yep. So this will actually check the prescription of your eye. Stay still. Perfect. 1 second. Perfect. Okay. Now let's try the other eye. Okay, good.
Doc Reg, what part of my eye is this machine trying to test?
So it's actually trying to test the whole eye.
Okay.
It's trying to test the whole optical system. If basically it gives us a rough estimate of your eye grade.
What are some of the more common eye problems that Filipinos have in your experience?
Common eye problems, aside from having like ametropia or needing glasses, styes are quite common.
Eye can either be caused by different things, no? But more commonly known sa mga Filipinos as a kulite. Styes or kulite, what normally causes this? Is this normally really caused by looking at things that you shouldn't be looking at, Dr. Reg?
So it's usually caused by dirt in the eye. So most of the time, it's caused by dirty hands. So if you have dirty hands and then you touch your eyes, and then you block one of the ducts on the eye, that can cause a stye to form.
What's next in terms of basic eye exams? Have we covered all the bases so far with your equipment?
So far, after checking your grade and then using loose lenses here, and if we find out that you don't really have a prescription, then we move on to the next, which is a slit lamp here, which is basically a microscope. We want to criticize or scrutinize your eye up close.
Okay, Dr. Reg, let's do that. Let's show our viewers what entails in using a slit lamp.
All right.
Okay, so
I'm just going to move the machine here. Yeah, thank you. You got it.
Now, if the other machine was trying to look at my whole eye, are we still trying to do the same with this machine?
No, this one is more for the front part of the eye. We want to just check if there are any gross abnormalities, making sure that there's no... Usually we can rule out any cataracts from this simple machine.
Speaking of cataracts, Dr. Reg, what are some of the more common symptoms kapag ang isang tao ay nag-uumpisa na magkaroon ng cataracts?
So usually it's it's very generic, but cloudy blurring of vision. And usually it's painless. And based on data, we usually see them when the patient is elderly, like 60 and above.
Now, also, I'm sure a lot of our viewers, whenever they hear cataracts, they also hear the condition called glaucoma. How different is that naman, Doc Reg?
So glaucoma is a silent killer. It's actually, most of the time, it's painless, and it can cause irreversible blindness. So patients really come and then they're at the advanced stage, and then that's it. You can't really do anything about it anymore because it's so advanced. So we do advise patients, or at least regular individuals, to have regular checkups just to screen or rule out any glaucoma.
Now, speaking about regular checkups, how often should our viewers have their eyes checked? Because similar to like maybe a dentist, where it's twice a year, for good eye health, para makita talaga, how often should they visit an ophthalmologist?
So usually it's annually. Once a year or once in 2 years, so that should be okay.
Now, Doc Reg, that was definitely good advice for our viewers on how often to take their basic eye exam. Thank you for showing that as well. Our 5 senses are all interconnected. When we return, we'll learn more about the connection between our ears, nose, and our throat. Stay with us here on Med Talk, Health Talk. We need our senses to perform everyday tasks. From our sight to our hearing and to our sense of taste, all of these are equally important. Let's take a look at best practices to care for our ears, nose, and throat. Welcome back to Med Talk Health Talk. Your ears, your nose, and your throat are all interconnected. To tell us more about how all of these are interconnected and how important it is to have them functioning properly, we are joined today by Dr. Maria Lourdes Enecilia, who is an otorhinolaryngologist or an ENT head and neck surgeon who specializes in rhinology, and she's from St. Luke's Medical Center. Okay, Dr. Mari, now let's talk about the several medications nowadays, especially pagdating sa mga nasal sprays. Marami, lalo na nung dumang pandemic, a lot of nasal medications have come out that have claims of being able to protect us from viruses, bacteria, and all other things. So what's your opinion on this?
All right, so yes, there are lots of medications. Nasal sprays are pretty good because they work direct to the nose. They don't go to the rest of your body. So as ENTs, we use it a lot, like steroid sprays for allergic rhinitis, and they're pretty safe. But there are those that came out that didn't really undergo a lot of studies, and some of them use very strong chemicals, and they actually can damage the natural defenses in the nose. Instead of adding the protection, it removes the protection. So we just have to be very careful with what we select to put in our nose. The safest would just be a plain sodium chloride nasal spray, but everything else you might need to check with your ENT doctor.
Okay, very good advice there. Now, from our nose, let's move on now to our throat. Paano ba konektado ang ating throat sa ating ears, sa ating nose?
We mentioned earlier, the inside part of your ear, there's a connection to the nose, the eustachian tube for balance of the air pressure. And the nose goes all the way to the back and down the throat. So they're really connected. Kaya ENT, hindi pwede pong maghiwalay yung ears, nose, and throat. So connected pa, what the nose is exposed to, usually the throat is also exposed to.
Okay, and one of the more important things in our throat is our voice box, or kung saan naproproduce ang boses ng isang tao. Now, let's talk about ways in which we can preserve our voice, take care of our voice para nandyan siya all the time.
So one is how we use our voice, especially for voice professionals like you. Nauso ang Zoom, online meetings, we have to project more with our voice kasi naka-off ang camera. Minsan nasistrain po, we're not using it properly or not good posture while speaking. All of those add strain to the voice and we overuse it. So dapat careful po tayo, we use it properly, and hydrate. Na nakakalimutan natin uminom ng tubig. Iba po ang soft drinks, iba po ang alcohol, iba ang coffee. We really need to hydrate because the skin in the vocal folds is very thin. So if it's dry, it can easily get damaged.
Okay. Now, for those who use their voice, as you said, as part of their living, this is very important as well. Pero meron mga tao, Doc Mari, na kahit anong gawin nila, may paos ang boses nila. Is this something to be concerned about?
Yes, definitely. When you first get your paos or napaos po ang patient, usually voice rest. Or for example, if you have cough, you can expect that you might get a little bit of hoarseness from too much coughing. But if no more cough and you're not using your voice anymore, you're rested, and the hoarseness is there for more than 2 weeks, it's time to see the doctor because there could be something else wrong.
Okay, so moving on from our voice, let's talk about now yung ating liig. A lot of people might all of a sudden find something peculiar on their neck. Meron silang nakakapa, meron silang mga malilit na parang hole nararamdaman sa leeg nila. This could most likely be a lymph node or tinatawag na kulane. What should people be concerned about kapag meron silang nakakapang lymph node or kulane?
So yung kulane or lymph nodes, we have hundreds of these normally in our neck, but they're pretty small. And they're part of our defense again. So they react to anything that they recognize as an enemy. Okay, so when you have cough and colds, infection, pwedeng lalaki siya, sasakit siya, but usually within a few days, wala na. Again, if you have that infection, then see a doctor. But if it's something na lumalaki tuloy-tuloy, hindi masakit, more than 2 centimeters na, more than 2 weeks na, andun pa rin, it's really time to see your doctor because it could be something else also.
Okay, so part also na parte ng leeg na pwedeng makapa is actually our thyroid. So let's talk about that a little bit. Ano bang purpose ng thyroid natin at bakit pag sinubukan kong kapain yung thyroid ko, wala naman ako nakakapa?
Yes, so we all have a thyroid. That's one very important thing. It produces the hormones we need for metabolism. And medyo uso yung terms na hyper or hypothyroid kasi nga yung hormones for metabolism. But pwede ka rin po magka-problem na bukol sa thyroid kahit normal ang hormones, and that one will need to be evaluated kasi it could be something that will need to be treated kung lumalaki po. Normally, dapat hindi siya nga nakakapa like what you said.
So are there any food to avoid para mas maganda ang ating health with our thyroid or even with our nose or our ears?
Well, generally good, healthy diet, which is actually not easy nowadays. We try to maintain a good, healthy diet. Our salt is iodized already, so that addresses the problem of goiter due to iodine deficiency. Good, healthy diet also, well, yeah, vegetables are good, but sometimes we need to balance a little bit, sometimes with meat because of the iron that's there and the vitamins and the different fruits and vegetables. Wag lang po sana isang klaseng food type. And exercise, of course, getting out, vitamin D from sunlight. Takot lahat po tayong Pinoy magpa-araw, but we need that also to get natural vitamin D.
Okay, napakagandang information, Doc Mari. To wrap things up, do you have any message for our viewers, especially when it comes to the health of their ears, their nose, and their throat?
Okay, so first, let's trust our body. Our body's own natural cleaning mechanism, whether it's the ears, the nose. Sneezing once in a while is normal to clean the nose. Maybe hydrate, keep our nose healthy. Water is the best therapy. Exercise, proper diet. But in general, if a problem is lasting more than 3 to 5 days, you go see your doctor. If there's bukol na nakakapa or hoarseness more than 2 weeks, patingin na rin po sa doktor.
Okay, napakagandang information na yun talaga. So thank you so much, Dr. Mari, for sharing your information, your expertise for that matter, to our viewers about that. Now that we've discussed ways to care for our eyes, ears, nose, and throat, when we return, we'll learn more about our body's largest organ, the skin. Keep it here on MedTalk Health Talk. Did you know that touch is the first of the 5 senses to develop in a human's body? Our skin's sense of touch sends our brain vital information about our environment. That's why we need to take steps in our everyday to protect our skin, just as it protects us. Now, to help us understand more about this, we are joined today by Dr. Winlove Mojica, who is a dermatologist and clinical associate professor of the UPPGH Department of Dermatology. Now, before we talk about how our viewers can protect their skin from the UV rays or yung ultraviolet rays ng sun, pag-usapan muna natin ang skin, especially ng Filipinos. Let's talk about that, the skin phototypes o yung kulay ng ating mga kababayan. How does this affect the risk or does it protect us from the UV rays?
Ang mga Filipinos would usually have brown skin, ano? We are considered to have a skin of color. So usually Filipinos have more brown pigment in their skin compared to other individuals from Western countries. So usually the phototype will be on the 3 to 4 phototype. But some Filipinos would have also lighter skin and some Filipinos would also have darker skin. But in general, we are brown skin. And this brown skin is usually protective of UV rays because the more pigment, the more there is a scattering effect or protective effect from UV rays.
So does this mean if Filipinos are usually on the darker skin tone, like you said, around 3, 4, does this mean we don't need to worry about going out into the sun without protecting our skin?
Not necessarily, although Filipinos in general are protected from skin cancer because they have brown skin cancer still occurs in Filipinos. No, we still have basal cell carcinomas, squamous cell carcinomas, our farmers, our workers who are exposed to the sun, specifically MMDA, mga nagtatrabaho sa kalsada, mas mataas yung risk nila for skin cancer still.
Okay, Doc Win, that's important to note since you mentioned skin cancer is also a risk even sa kulay ng balat ng ating mga Filipinos. When it comes to skin cancer, we all want to be cautious about this, preventive about this. What are some symptoms or ano ang makikita ng mga tao that may prompt them to seek consult with a dermatologist na huwag ibaliwala?
So there are different types of skin cancers. But meron tayong tinatawag na ABCDE rule para maobserbahan kung ang isang bagay na tumutubo sa ating balat ay isang skin cancer. So yung A, tinatawag na asymmetry, hindi pantay. Dapat perfect, kunwari may nunal, dapat perfect na bilog siya. B, the border. Dapat alam mo kung saan nagsisimula yung kulay at kung saan nagtatapos. Kung medyo fuzzy or hazy yung border, baka yun ay skin cancer. Color, dapat isa lang yung kulay. So, either completely brown, completely black, or completely blue. Pag iba-iba yung kulay sa loob ng isang nunal, may pula, may brown, may blue, baka yun ay skin cancer. Diameter, pag siya ay lumalaki, Okay? Dapat habang tumatanda tayo, hindi na lumalaki yung mga nunal. Pero pag siya ay lumalaki, patuloy na lumalaki, baka yun ay skin cancer. And last, evolving, letter E, yung sa ABCDE. Nagbabago yung itsura niya over time. Nagbabago yung kulay, nagbabago yung size. So yan ang mga senyalis na maaring kayo ay merong skin cancer.
Now let's go back to protecting ourselves from the UV rays ng sun. Ano ba yung best ways to protect ourselves? Alam ng iba, sunblock lotion is good. Ano bang SPF ang maganda?
Marami kasi sa atin, walang pambili ng sunscreen. So the simplest way is to avoid the sun. While we still need the sun to produce vitamin D, ang sinasabi natin na avoid the sun is avoid it from 10 a.m. to 2 p.m. Because yan yung time na pinakamataas yung energy ng araw. And yung energy na yan, mas mabilis makasira ng balat, cause ng premature aging, ng burn, at ng skin cancer. So yung 10 a.m. to 2 p.m., mas maganda na sa loob tayo ng bahay. Pero may mga pagkakataon na kailangan nating lumabas, may kailangan tayong gawin sa labas. Minsan magsampay ng damit. Kung merong paraan para makakuha ng sunscreen, ito ay magandang paraan para maprotektahan yung sarili natin from the sun. Protecting yourself from the sun, not going out from 10 a.m. to 2 p.m., wearing proper clothing, and then if you have extra budget, you can use sunscreen.
Okay, very good information there. Now let's talk about kung anong nauuso ngayon, Dr. Wayne, which is ang glutathione. Marami mga Filipinos would like to lighten their skin tone, maybe for aesthetic reasons. But let's talk about glutathione in general. Ano ba ito? Because glutathione is naturally produced by our bodies. Could you talk about what happens? Or what are some of the risks kapag we take more of it, more than that our body needs?
First, let's talk about what glutathione is. Glutathione is an antioxidant like vitamin C. So, an antioxidant is a substance that reduces free radicals in the body. Yung free radicals, napoproduce yan during the normal body processes. Para siyang basura. So, pag naipon yung free radicals, mas tumataas yung chance mo magkaroon ng mga sakit tulad ng heart disease, stroke, at yung mga katulad na ganong sakit. Yung glutathione, you are correct, it is normally produced by our body in the liver. And there's this misconception that you have to take oral glutathione or inject glutathione to protect your liver. Baligtad. The liver is the organ that detoxifies the body. Baligtad. So, you need to protect the liver so that it can produce glutathione and continue protecting the body. One of the best ways to protect your liver is not to drink alcohol. So, ayun ang kung gusto natin na mas maraming glutathione sa katawan natin, we need to protect our liver so it produces more glutathione.
Thank you so much for sharing those and for joining us here on MedTalk Health Talk. These small changes in caring for our senses is not only vital to our health, but in our overall well-being as well. I'm Dr. Freddy Gomez. Thank you for joining us here on MedTalk Health Talk.